Welcome back to the Noon Show, everybody, here on TV2. I'm David Burns, and this is Ask the Expert. And today we are with glaucoma specialist, Dr. Kurt Schwiesow from Tower Clock Eye Center here in Green Bay. Thank you for joining us again, Doctor.
Thank you.
Second leading cause of blindness worldwide, and that is glaucoma. Many people, they don't even know that they have it. But once diagnosed, what are the most common forms of treatment for it?
Well, like you said, glaucoma is very common. So a lot of my patients know family members or relatives or neighbors, people who have glaucoma, and they're familiar with the concept of treating it with eye drops. That's probably, I think in this country, the most common way that we would treat glaucoma. There are a number of different treatment options. Glaucoma is an issue where the pressure in the eye is a little too high. So all of our treatment options are based on reducing the eye pressure. And despite all the research that's been done on glaucoma, and there is a lot, it's a very common disease, so there are always new treatment options being researched. Despite everything that we know about glaucoma and all the research that's been done, the only effective treatment that we found to this point is reducing the eye pressure, all right? So not vitamins, not supplements, not really exercise or activity. It really hinges on reducing the eye pressure. So the way that we do that, there are a number of different treatment options. There are eye drops, as I mentioned. There are a number of different eye drops that can be used. So some patients can be managed with 1 drop a day. Some patients might need 2. Some patients might need 3 or 4, although we try to avoid loading patients up with that many medications. Other treatment options that are very effective would be laser treatments. This is typically an in-office treatment. It's really no worse than having an eye exam from the patient's perspective. Very, very low risk. So we do use that frequently for patients to help manage their eye pressure. In some instances, we need to go on and do surgery, all right? So there are surgical options for treating glaucoma, and a lot of these surgeries hinge on making a new drain for the eye. What I always tell patients is, look, the drain you were born with that's supposed to keep your eye pressure normal just isn't working. So what we're going to do is make a new drain. And there are a number of different ways of doing that, but it does require surgery in the operating room. And with that always comes some potential risks. So we try to hold off until we've explored other options first.
Okay, we're talking with Dr. Kurt Schwiesow from Tower Clock Eye Center, who is a glaucoma specialist today. And if you have any questions about your eyesight, what's the website to go to?
It's www.towerclockeyecenter.com.
Okay, and you see the information there on your screen. Or if you'd like to see this again, please go to WBAY.com and click on Ask the Expert. I'm David Burns. Thank you, Doctor, for joining us. More of the Noon Show coming up right after this.